Welcome to On the Beat, everyone. I'm over here with Dr. Alan Pritchard from Plastic Surgery of North Mississippi, and today we're breaking down the myths of dermal fillers. Welcome back to the show, my friend.
Thank you. Glad to be here.
Alrighty. Let's explain to everyone at home. We hear about injectables, okay? That is everything from dermal fillers. It's from Botox. People talk about Juvederm. They talk about Sculptra. But what is a dermal filler?
A dermal filler basically is a volume replacer.
Okay.
And they're come in different thicknesses, I would say. There's thick, there's thin, based off the injection. But they are wonderful for people who aren't ready for facelifts.
Yes.
You know, and they say, would you just fill in these kind of creases around my face and shallow some of these and get some fine wrinkles out? And it does it great. It's a wonderful thing. Yeah. You have to consider it temporary. You may have to do it again in a year or so, but it buys you time, I guess, if you don't want to have a surgery.
Well, I think it's sort of replacing what we lose as we age.
Right, exactly.
What is the cause of us losing fullness in our face as we age?
Well, there's a loss of soft tissue loss and bone structure changes also.
Okay.
So you see the sagging jowls and excess skin because the face is a little smaller. Okay. And most of it is what we call in the triangle, from the nose.
Oh, I love that terminology, yeah.
And that is where we focus. Everybody walks in, they say, my face is kind of bad, but look at my mouth. You know, it's everything around it is sunk in. And these dermal fillers remarkably can instantaneously reverse that.
How is that happening? Now, we know we're injecting something. Where are we injecting it? Into the skin, into the muscle, above the bone? Explain that part for me.
Very good. No, we don't inject. We can't. Well, around the eyelids, you're hearing people do trough injections now. Now, that's right down where the muscle fibers are attaching to the cheek, and we are injecting into the muscle area there. Right. That's correct. Up in here, we're doing it more into the sub-Q, below the skin, between the skin and the muscle. Right. And that's where a majority of our injections go at that point in time.
All right. What is it actually made up of?
Hyaluronic acid. Okay. And they're all basically come from that main. We all have it in our bodies, so it's not going. You're not going to have a major reaction to it. You know, a little redness perhaps, but that's where it comes from.
Okay. I want to get down to term of lifespan. I was to come into you, say today, and I had a particular product, say Juvederm. Yeah. All right, in my cheek area. How long would I expect that to last?
The average is about a year.
Okay.
And I have a few patients that insist it's gone longer. Okay. But a year is what I tell my patients.
Like I've always heard people say, well, if you go to the gym and you work out and you're really active, it doesn't last as long. Have you heard that gossip out there?
Yeah, but I can't buy into that.
I get you. It's not really true, is it?
No. The only thing I've only ever had people, well, now, if you put pressure on something that the doctor injects, you can put it into parts of your face nearby.
Let's talk a little bit about the side effects.
What would be a side effect? Redness?
Yes. Okay.
Asymmetry, you know, too much over here, a little bit less here. Bruising. But as far as major reactions, you don't.
Okay. So the common areas that we would be using injectable on the face or dermal filler, which would be where?
Mostly, well, anywhere on the face. Okay. But around the mouth, we use them from the nose down around the mouth area and jowl region, and we're also around the eyes. Okay. And cheeks. A lot of people want to have more of a youthful look, and so we can, with very small amounts, increase that youthful look.
And you can give it a little bit of a lift at the same time, can't you?
It does relatively lift up here a little bit.
I like it. I like it. All righty. Well, we want to celebrate by having Dr. Pritchard on the show, and he's decided to allow all of you to give him a call. There's the number and the great promotion up on the screen for you now. Give them a call, purchase one syringe of dermal filler, and get the next one at 50% off. Guys, that's a saving of up to $400. Let's also bring up all the information on how you can get hold of Dr. Pritchard and his amazing team, and we'll be back after this short break.